Vascular disease, it can impact millions, and Cone Health doctors say it's one of those diseases that many people don't realize they have until the situation is serious. We spoke with an Eden woman who knows all too well about the impact. Vascular disease affects a person's blood vessels, which help carry blood throughout the body. 72-year-old Mable Moses, a former patrol officer, was diagnosed with it 12 years ago. She says her legs were hurting and she struggled to walk. As the pain progressed, doctors suggested that she visit a specialist.
Well, the surgery was bad. It hurt. I was in so much pain after they got through. But I got up and I started walking because I knew I had to. This is not a disease that you can mess with.
You see, she had a heart attack in 2010 before doctors diagnosed her with vascular disease, but her connection to heart health spans long before that. Moses lost her mom back in 1996. She too suffered from a heart attack and later died from cancer. She says doctors told her that genetics played a role in her diagnosis.
Anytime you have something like this going on, you can and you will get depressed. It plays not only on your heart, your vascular veins. I mean, I've got stents all over my body.
Moses is currently living with the disease, but she manages it thanks to her doctors at Cone Health. She's encouraging everyone to listen to their bodies.
Please notice your body and not just think that it's arthritis or something you can deal with. Notice your body and then go to your doctor and have the test that you have to have.
All right, so as we just heard, important to know the signs of vascular disease and to get checked out. So to talk more about what we need to know, how to spot warning signs, when to seek help and reduce our risks, we're talking with Dr. Tyler Buckley with Cone Health Vascular and Vein Specialist. All right, let's just start with the basics so everyone kind of gets it. What do vascular conditions like narrowed arteries or coronary artery disease mean for someone's health?
So narrowed arteries and arterial disease can cause significant problems for someone's health. Essentially, just so we're all on the same page, arterial disease is basically a buildup of plaque in arteries, and depending on where that plaque is can cause different problems. I like that you mentioned coronary artery disease because that is the most common place, but we also can get buildup of plaque in the carotid arteries as well as the leg arteries.
Okay, and so because of that, a lot of people right now are thinking about themselves, okay, that's a lot of like medical speak, that kind of thing. So let's just even bring it down. What are some most common warning signs that folks should be watching for?
Unfortunately, when it comes to arterial disease, there's not that many warning signs before pretty significant symptoms can occur. It all depends on the vascular bed that the plaque is in. So for example, in the coronary arteries, which is what our cardiologists treat, people can develop chest pain when walking, shortness of breath when going up a flight of stairs. But when it comes to arterial beds such as the carotid arteries that bring blood flow to our brain, or the leg arteries, you really don't notice anything until you start having symptoms.
Okay, and are there some symptoms, let's talk about the symptoms we absolutely need to be watching out for, and then maybe some ones that are kind of subtle that we may just be passing off.
Absolutely. So in the carotid arteries, there's really no symptoms before it is dangerous, meaning this is relatively asymptomatic until someone has a stroke or a mini stroke. In the leg arteries, you can start having some leg pain when walking, you can start having some foot pain, and if it gets really bad and we don't catch it early enough, you can actually end up with wounds which lead to an amputation.
Okay, so we want to back up even more because we want to think to ourselves, all right, when does someone need to pick up the phone, call their doctor and say, hey, I think something may be going on?
Definitely when they're starting to have foot pain when walking or calf pain when walking. In the carotid arteries, like I said, there's not much room for catching it early other than screening. And we have different screening tools that help us. And your PCP should know your medical history and know if you would qualify for a screening, which is just an ultrasound. But in the periphery, you should definitely, seek further vascular care. if you're having foot pain or leg pain when you're walking. That's usually the first sign.
Okay, and you mentioned that with the screenings that an ultrasound would be something for someone who maybe has never had one of those. What does that entail?
So typically if you come into our office and you're complaining of leg pain or calf pain when walking, the first test is just called an ABI, or an ankle brachial index, which just means we're putting some blood pressure cuffs on your ankles, some blood pressure cuffs on your toes, and we're assessing what kind of perfusion you have down into your feet.
Okay, and then the ultrasound would also be a different kind of screening?
So that's just a further, another test that can further give us some information about the blood flow in the legs.
Okay.
That's also the screening that we do for the carotids, as well as an ultrasound of the neck.
Gotcha. And that doesn't start with you probably, it does start with our primary physician to kind of feel that out first?
Correct, yeah. So it would start with your primary care doctor who would evaluate exactly what symptoms you might be having, as well as your medical history to see if you might need a carotid ultrasound or a screening. And they'll order the test and then send you to us.
Cone Health has a new vascular lab that is opening soon. So let's talk about what that means for our community members and treatment for heart and vascular health.
Right, so that's a really big deal. One, all of us, myself and our vascular partners, as well as our cardiologists and cardiothoracic surgeons, are all going to be under one roof. So getting patients in to see different clinics or getting different testing should be a lot more streamlined, which we're all excited about.
Yeah, and that's, I mean, great for the patient too, because they don't have to go from one doctor's office to another, to another, to another, and all underneath one roof. That helps alleviate from frustration for sure. All right, what happens if vascular issues just simply go untreated?
So if they go untreated and, we have certain risk factors like uncontrolled blood pressure, uncontrolled diabetes, current smoking, it can lead to worsening of these plaques, which in each arterial bed causes a different problem. So in the heart, if you have coronary artery disease, that can lead to heart attacks or myocardial infarctions. In the carotid arteries, it can lead to strokes, and down in the legs, it can lead to pretty severe pain, can eventually lead to wounds, which potentially cause a patient to undergo an amputation.
Okay, so when you're talking all of these things, we're all like our eyes are getting bigger and bigger the more that you talk, because all of these are just such serious situations, and we're thinking to ourselves, a lot of times there's not symptoms, like you said, until it's too late. So what are some practical steps that we can do to help reduce our risk of any of this happening?
Right, so let me just clarify. It's not that it's too late, but it's the fact that you already have some plaque buildup once you start having symptoms, and there's no reversing that. The best way to prevent plaque buildup or worsening of these plaques is just controlling your risk factors. For most people, that's controlling their blood pressure if they have high blood pressure, controlling their cholesterol if they have high cholesterol, making sure their diabetes is under well control. But the biggest risk factor and the most important thing to do is to quit smoking if you're a smoker. That's been shown to be the #1 risk factor leading towards plaque in any artery, whether that's the coronary arteries that feed the heart, the carotids that feed the brain, or the legs.
And then people at home might be saying, all right, well, does lifestyle change really make that much difference for someone who's already been diagnosed?
It can make a huge difference. For example, if we talk about peripheral arterial disease, which is the leg arteries, if someone is in stage 1, which means their calves cramping when they walk, but they're not having terrible pain in their feet, they're not developing wounds, they're at a less than 1% chance of having worsening of their disease leading to amputation if they make the correct lifestyle changes. Now, if they don't quit smoking, if their other medical issues go uncontrolled, that can progress relatively quickly.
All right, and I think when we listened to the patient here from Eden who said everybody needs to pay attention to their body, a lot of times I think we let things that are happening in our body and we just go, oh, it's fine. I don't need to talk to the doctor about that.
Right, and I'm guilty of that too, I'll admit it. But there are times that things should be, should ring a bell, and things can be significant. One, if you ever have symptoms of a stroke or a mini stroke, that's not even calling your doctor, that's going immediately to the emergency room. If you're starting having some foot pain, some cramping when walking, that can be a discussion with your PCP about, do I have peripheral arterial disease leading to this problem, and what can I do about it?
All right, and finally, as we are kind of like wrapping things up, what's your best piece of advice for those of us when it comes to protecting our vascular health?
Absolutely quitting smoking if you're a smoker. That is the #1 risk factor. And then everything else is just managing your underlying conditions. So controlling your blood pressure, controlling your diabetes, controlling your cholesterol.
All right, well, Dr. Buckley, we thank you for your time and your expertise. And if you missed any of this, maybe you want to send it to a friend or a family member, it's going to be on our website in the To Your Well-Being section.